that's going to potentially be a problem. Anytime you have a finger, it's always the PIP. So we think about location. We think, where is it? Are we gonna have a problem with the MP, or we're gonna have a problem with the PIP, or we're gonna have a problem with the DIP, right? And then we look at severity. We're looking, well, it's severe because it's angled and it was not stable, right? Another type of severity we think about is blood supply, right? Didn't I say that when we look to, for the bones to heal, there has to be a certain amount, you know, of blood supply for that callus formation, right? In cases where you have a crush injury, crush injuries break those arteries, and so it becomes more complicated. Crush injuries become more complicated because there's tendon involvement. Crush injuries become more complicated because the ligaments get stiff, skin gets scarring, all that stuff. In her case, her only problem was angulation, but I know so many other hand cases that if we go back to that what's wrong framework, is it bone, is it tendon, is it ligament, the more complications you have, the more you can add to it, right? So if I was a fracture and a dislocation, what are some problems I'm gonna have? It's gonna be a bone problem, it's definitely a ligament problem, and then the tendons are gonna get stuck problem, right? So that's how you can keep adding to your framework. But for the most part, you can break down any kind of hand injury that comes your way based on where's the fracture, did it fracture? And sometimes you don't get anything from a doctor, you just ask your patient, hey, do you know your bone got broken? You know, and they'll be like, yeah, it was broken, perfect, you know? And they'll tell you a little bit more about what's going on. But you can also determine based on what you're allowed to do, based on when their injury was. Well, how long ago was it? Well, it just happened last week. Well, we're gonna take it nice and easy. We're just gonna move the other joints to make sure there's nothing else going on. But if it's been 4 weeks, okay, let's go. We can move it a little bit more. We're gonna start to make sure that there's no complications. You go into extension, you go into flexion, all that good stuff, right? Age becomes a thing too in terms of, well, are they older? Do they have comorbidities in there? Right? Comorbidities are if they have, I always look at both hands and I say, do they have a history of arthritis? Because arthritis tends to happen in both hands, right? So I always look at both hands and I say, oh, where were your hands before? Because I had this one woman, she came in, she had a distal radius fracture. Her fingers were stiff as a board. One finger went down, the other one, like all her fingers were different. And the doctor was giving us, you know, like, why? The doctor's mad at you because, you know, my fingers aren't moving. And the therapist's all frustrated, the fingers aren't. I said, well, let me see your other hand. Well, the other hand was jacked up. Well, like, I cannot make you better than how you started with me. So so I asked her, I said, well, how were your fingers before? Did they look like the other hand? Because yeah, I see the arthritis here, here, and here. She was like, yeah, they were like that way. Well, shit, I have comorbidity. I shouldn't get frustrated that I'm somehow supposed to make this hand be any more. I mean, obviously I had a lot of work to do, but listen, the woman had comorbidities, and the stress shouldn't be placed on her her hand to be perfect like the next person's hand, right? And our job as therapists shouldn't be to be like, oh my God, why can't I get her better faster? Well, she had tons of comorbidities. I have people who come in who smoke. I mean, I have this severe hand case and he smokes, God knows how, and he comes in like a chimney. Well, shit, blood supply, you know? So there's so many things that we know that when we can break it down in our head, it's gonna let us know what we're allowed to do, what we're not allowed to do, how far we can go, and how we can ease our frustrations, right?